Hi, my name is Bruce Bassi. I'm a psychiatrist with Telepsych Health. I see patients in multiple states around the country via virtual visits, which are secure online visits. And today I'll be talking about what is telepsychiatry and how do I prepare for my first visit. So what is telepsychiatry? Telepsychiatry is essentially secure, HIPAA-compliant FaceTime. And so it's essentially like FaceTiming on your laptop or on your iPhone or Android device. It's very easy to use. All you'll do is make sure you have fast internet and prop your phone up on some sort of wall or desk and make sure that the practitioner or provider can see you and has a very clear, distinct view of yourself. And that there's no lag and that you have your microphone turned on. And so there's a number of technical issues you might have to think about, but it's very easy to use. And evidence shows that there's not any difference between telepsychiatry and in-person visits. Providers can prescribe medications directly to your pharmacy. They can do therapy. Usually your copay is exactly the same as an in-person visit. Patients might feel like it's a little awkward at first, but it's actually quite easy to get used to and get comfortable with. And before you know it, it doesn't feel any different than an in-person visit. Some people do notice that or do feel that they want to just have an in-person visit just because of that's their personality and that's how they feel. They just want to be in an in-person session, but that's their prerogative. That's totally up to you. And I can understand that. I can understand people want to just have that in-person feel. But for a lot of patients, not having to drive hours to go see their provider, not have to go into a provider's office and feel uncomfortable with that transition, being able to stay in the convenience of your own home, that can be very attractive for a lot of patients. And given that a number of data and research suggests that the outcomes aren't any different, meaning that people still progress and improve just the same as if they were in an in-person visit, I think that gives patients a very attractive option, given that on average, 10 to 15% of patients move every year. And so it's possible that after the next year, you have to move for job reasons or for family reasons. And then before you know it, you're not actually in a location that's convenient to get to see your psychiatrist or therapist. And so having the option of doing it online can eliminate those geographic barriers. So some patients might not be totally appropriate for doing telepsychiatry, and that's something that's ultimately up to your provider and their experience and their comfort with seeing you via online visit. And maybe some of this has to do with the stigma behind psychiatry and stigma behind telepsychiatry, and that makes people err on the side of caution. But people who have recurring suicidal thoughts and they're pretty consistently going in and out of the hospital and they're not necessarily in a stable spot, maybe telepsychiatry is not a good modality for therapy at this moment of their lives. Maybe they need to make some more adjustments in person, do partial hospitalization, do intensive outpatient programs, and then step down to a little bit more flexible level of care known as telepsychiatry. Also, for people who have obsessive compulsive disorder, there's one type of therapy known as exposure response prevention therapy. And so what that involves is essentially doing a graded exposure to a particular situation that is under the supervision of a therapist or provider and working through those symptoms that you're having. And so it's very difficult, very challenging to do this via telepsychiatry. And so that's another contraindication for telepsychiatry. Another contraindication to telepsychiatry is that if you're wanting group therapy, it might be very difficult to replicate that group interaction via online visits. It might be better for you to seek a group session in person. Some people with cognitive impairments, it could be more difficult to do psychological testing, although I know people who do psychological testing via telepsychiatry, it could be more challenging to do so. Also, patients who have certain involuntary movements from a group of medications called atypical antipsychotic medications, and these types of movements are called tardive dyskinesia or extrapyramidal symptoms. It could be very difficult for the provider to pick up on these, and so it requires a little bit of cooperation with the patient to do that analysis and do that testing to see if they have any of these sort of involuntary movements. And so that's another challenge of telepsychiatry. All in all, though, I really think that telepsychiatry is a great modality for seeing patients, and it removes that geographic barrier and it allows patients to feel a little bit more comfortable in their own home and see the provider from the comfort of their own home. And so I really enjoy it. And I think for patients who buy into the idea of telepsychiatry and are comfortable with the technology itself, are okay with the setup on their computer or laptop, it could be a very useful form of communication with their mental health provider. In regard to some of the technical aspects of telepsychiatry, so you want to make sure you have a fast computer or a fast phone with a good camera, a good microphone. If maybe you want some headphones, if you want to maximize privacy, if there's people coming and going around your house or apartment. You want to make sure you have a good solid internet connection where you're getting at least 10 megabytes per second download and upload, and you can check your internet speed by going to Google and just typing speed test and then seeing whether or not you have at least 10 megabytes per second. And then also you want to make sure that you have good front-facing lighting so that the provider can pick up on any sort of nonverbal cues. So you want to minimize the amount of light that's coming from behind you so that it doesn't wash out your face and make it look dark. So I hope you enjoyed this overview of telepsychiatry and who would benefit most from telepsychiatry, who maybe should consider in-person visits, and some of the technical aspects of this. I do have an article on my website under the mental health articles section that describes a little bit more of the technical aspects of the setup. And so if you have any questions, you can always reference that. But otherwise, I hope you enjoyed this video. And I'm Bruce Bassey from Telepsych Health. I see patients in multiple states around the country via online virtual visits for general psychiatry and addiction psychiatry. Thank you very much.